Hey, this is Dr. Paul. I'm a child, adolescent, and adult psychiatrist, and I'm here to talk to you about mental health issues. And I just got an email from someone asking about different types of depression. So, are there different types of depression? There definitely are. And so, today I'm going to go over 6 different types of depression and give you some sort of a broad overview of what they look like. Again, if you think you do have one of these syndromes, definitely seek professional medical advice, see a counselor or therapist that's licensed. So here we go. Number 1, major depression. Major depression is sort of the most common type of depression. What differentiates it is from just feeling down, sad, or unfortunately losing a family member, a loved one, a pet, spouse, is that it's episodic, okay? It comes on pretty drastically, and it involves a time period of 2 weeks at least or more where you're feeling down or depressed most of the time, most of the day. A lot of people have trouble getting out of bed, completing necessary things to get through life, brushing their teeth, taking a shower, going to work, taking care of their kids. A lot of people with major depression have sleep problems, weight gain, changes in appetite, fatigue, low energy, problems focusing, thoughts of guilt, shame, low self-worth, sometimes even suicidal thinking. So if you do have anything like that, in that cluster of symptoms for that time period, that may be what's going on. Number 2, dysthymia. Dysthymia is a little more insidious. Dysthymia typically is a lower level of depression. It's less intense. It's not episodic, meaning it doesn't come out of the blue, sort of and spike your mood. You're chugging along, you're doing well, and you have this massive dip like in major depression. Dysthymia is more of you've been sort of on a low level of depression or having some feelings of major depression that really have affected you persistently for a long time. And in adults, that time period is over 2 years. In children and adolescents, it's over 1 year. A lot of the similar symptoms, again, weight changes, sleep problems, low energy, low self-esteem, problems focusing, feelings of hopelessness. Number 3 is premenstrual dysphoric disorder. Premenstrual dysphoric disorder, or PMDD. PMDD obviously occurs just in women. They do have a menstrual cycle, men do not, obviously. And it's diagnosed, it's a diagnosis of a mood disorder that occurs around someone's menstrual cycle. Typically, what you do see are mood swings, sadness, sensitivity to rejection, anger, and irritability are more prominent. Hopelessness, anxiety, difficulty concentrating, as well as issues that are, that involve your body, appetite changes, low energy or lethargy, breast pain, bloating, joint pain, and sleep changes. Number 4, seasonal affective disorder. Seasonal affective disorder, or also called SAD or SAD, typically occurs in the winter months, and a lot of people who live in the northern parts of the country, Michigan, Ohio, Alaska, feel more depressed typically when winter starts to set in. Days get shorter. They think that this disorder may have something to do with how much light is getting into the eye. There's different theories about this. I have another blog post on that. You can check that out on my blog as well, nowpsych.com/blog. And again, generally seasonal, generally occurs in the winter, and there are treatments that are different than the other types of depression. Well, as is the other ones I've mentioned as well, have slightly different treatment. Number 5 is postpartum depression. Postpartum depression is something that is getting more recognized, generally occurs after childbirth or right before childbirth. It can be severe. There is I think a change in every woman's mood when the hormone levels, because they are swinging wildly, start to settle out. Some women may feel more tired, lethargic. Also, not just hormones, your child's keeping you awake. Postpartum depression is different. Postpartum depression, again, is centered around the birth of a child. The hormone changes we know are integral, and it's a major depressive episode, and some women can be affected quite severely. If you do feel like you have this problem, talk to your obstetrician about it, talk to your primary care doctor about it, go see a mental health practitioner. Treatment in terms of therapy and medication really does help in postpartum depression. And if postpartum depression gets worse, it can lead to more dangerous things like postpartum psychosis, which I've talked about on my blog as well. Number 6, and the last one, is bipolar depression. Bipolar depression is something that is unique to all these other depressive disorders because it involves a diagnosis of bipolar disorder, and you have a depressive disorder. Bipolar disorder is diagnosed after having a manic episode. Okay, a manic episode typically is, again, a discrete time, a clear time period where that person starts to have lots of energy, racing thoughts, maybe feels amazing, maybe feels irritable and sad and amazing at the sort of a mix of those things, really distinct, don't need to sleep, feel great on 4 hours of sleep, 3 hours of sleep, have fantastic ideas about writing a book, going on tour, doing something that they could possibly do, but it's very unlikely that they could do, but they feel like they can do it. Inflated self-esteem, racing speech, what's called pressured speech. You can't get a word in edgewise. Some people do things really out of character, spending sprees, gambling, sex, drugs, things that they would normally not do. That's a diagnosis of mania. So to get a diagnosis of bipolar disorder, you have to have mania. Bipolar depression occurs typically after a manic episode, but can occur without a manic episode because maybe the mania hasn't happened yet. Maybe it's something that's happened in the future. Bipolar depression is typically extremely intense. Most people have a massive drop-off in energy levels. They are not getting out of bed. They are extremely suicidal. They gain weight. They stop functioning. So a lot of people in college that have a severe and major depressive disorder that's really, really intense, maybe they've had other depressive disorders earlier in their life, starting in their teen or even middle school age, particularly that have a family history of bipolar disorder in their, parent, grandparent, someone, you have to think about bipolar depression, whether that person has had mania or not. That type of depression is unique. It's very hard to treat, responds less robustly or less intensely to standard treatments, and you need to use different medications, have a different approach. So those are the 6 different types of depression. I hope that answered your question. For more information, please check out my blog, nowpsych.com/blog. Thanks for listening. Have a good day, guys.